going to share. Great. As you may have just heard, we are recording this webinar so that folks who are not able to join us this evening will have an opportunity to benefit from our presentation and from all of the good questions that I'm sure will be asked and hopefully answered as we go. So I'm going to pause for a moment and just share my screen, and there we go. We'll get started with some slides. So firstly, I'd like to welcome all of you to our webinar. So this is for the New York State Academic Dental Center's Fellowship to Address Oral Health Disparities, as you know. So wanted to start off really with an overview of the organization of New York State Academic Dental Centers, NYSADC, as we like to call ourselves. So firstly, I'd like to introduce myself. I'm Jonathan Tan. I'm the president of NYSADC, and also would like to introduce Jenny Tassler. Jenny.
Hello, I'm the Director of Government Relations and External Affairs here at NYSADC.
Great. We also have a number of faculty members who we will introduce as we go. But just as an overview, so NYSADC is, we are the consortium of the 6 academic dental centers in New York State. And we are somewhat of a unique organization. Most states don't have something similar. We have a large number of dental schools in New York. And so this organization was formed a couple of decades ago. And we really focus on in a couple of areas. We do collaborative programming, and this fellowship is an example of that. It's a collaboration of all 6 dental schools. And we also work on policy issues, particularly policy issues in New York State government in Albany, a little bit in Washington, D.C. as well. And this program, this fellowship program, really grew out of sort of the confluence of those two things. We were working on really addressing the lack of adequate access to care that that people with special needs experience, particularly people with intellectual and developmental disabilities. And we were doing some advocacy in Albany to, in part, address that through better reimbursement, better state support, particularly state Medicaid support for providing dental care for people with IDD. And this fellowship really grew out of that advocacy work, and we were looking at additional ways to improve access to care for this population. And so we were very fortunate last year to be able to start this program with funding from the Mother Cabrini Health Foundation, which is a private foundation that enabled us to support 2 fellows this year, and you'll get to hear from them, and we'll talk more about their programs. And we were likewise fortunate to get funding to expand the program this year with support from the New York State Legislature. And so really the intent of this program, and I'm getting ahead of myself actually, apologies. Let me quickly just take a step back and let you know what we'll be covering during this webinar. So firstly, we wanted to provide this overview, and I've sort of gotten through some of that. We also will talk in more specificity about the service commitment that's associated with with this fellowship. And then we'll hear from the program directors at Touro College of Dental Medicine and NYU about the structure of their fellowship programs this year. And then you'll have an opportunity to hear directly from our 2 fellows who will share some of their experiences. And then finally, we'll leave some time for your questions and at the end. And just quickly wanted to note who. If you can just make sure you're muted if you're not speaking, that would be that would be helpful. Thanks. I just wanted to make sure that that everybody understands who some of our faculty members who are on the call with us today are, and really give it a sense of who has been guiding this, the development of this fellowship program. So we have faculty from each of the 6 academic dental centers who have been really instrumental in creating this program and expanding this program, and will continue to guide this program as we grow it over the next couple of years. And so some of them are on the webinar today. And actually, why don't we just take a quick moment to introduce those faculty members. So I'm just going to go in order of who I've got here. So we'll start with Dr. Kaczynski. Oh, Ron, you're muted.
Good evening, everyone. My name is Ron Kaczynski. I am a pediatric dentist and dental anesthesiologist, and I am the clinical director of the NYU Oral Health Center for People with Disabilities. Welcome.
Thank you. And I don't believe that Dr. Gazzillo has joined us yet. I know she was intending to. Dr. Rostalski.
Hi, I'm Dr. Raquel Rostalski. I'm a dentist anesthesiologist and one of the 2 program directors at Touro College of Dental Medicine.
Great. And Dr. Bush.
Good evening, everybody. I'm Dr. Mary Bush. I am a dentist, and I am also the Associate Dean of Student Community and Professional Initiatives at the University of Buffalo School of Dental Medicine.
Great. And Dr. Planarova.
Good evening, everybody. My name is Adela Planerova. I am the director at Complex Care Center, which is located in Rochester with the University of Rochester.
Great. Thank you so much. So let's get back to the overview of the program. As I was saying earlier, really the intent of this program is to expand the number of providers in New York State who really have the skills and experience and desire to treat people with special needs. Again, really access is a real challenge for many people with, particularly with IDD. And so, we really wanted to capitalize on sort of the new requirements as required by CODA to give experiences to all pre-doctoral students with patients with special needs, really take that and build on that through this year-long fellowship program. And so the intent is to have a very intensive clinical year working with patients with special needs. And this is done at one of our 6 academic dental centers. And really most of the time, and you'll hear from the program directors, most of the time that the fellows are spending is doing direct patient care. And in addition, though, the way that we have structured the fellowship, our fellows are appointed as faculty at the dental schools. And we really wanted to use this program not just to educate our fellows, but also to help inspire and educate pre-doctoral students, residents, future practitioners, potentially future leaders in special needs dentistry. And so part of the fellowship is also devoted to teaching and research around special needs care. And so that can take a number of different forms. And as we grow the program, I think there's going to be much more opportunity for collaborative teaching and for collaborative research. And then, in fact, that's an area that we intend to grow the program over the next year, is really to set up a statewide network of fellows who can potentially do research projects together. That's a sort of very high level overview. Again, you'll hear more specifically from our 2 program directors about how they've structured the program this year. An additional component of this fellowship is that there is a service commitment in New York State following the fellowship year. So again, the fellowship year, you're fully supported in terms of salary, and you spend that year at one of the dental schools providing clinical care. And then once you finish the fellowship, there is a service commitment that Jenny will actually walk us through. So Jenny.
Sure. So as Jonathan mentioned, following the fellowship, we were requiring a single full year full-time or 2 years part-time at a site with significant IDD population in New York State. And we do have some flexibility around that. We understand that there may be differences in where you want to practice or how you want to practice. So we are offering the option of doing it over 2 years part-time, but we do really want to see the service in terms of giving back to these populations, treating populations out in the field. The goal of the fellowship is to increase the number of providers and the availability of service to patients with IDD. So this is an integral part of the fellowship. It would be immediately following completion of the fellowship, following a short grace period. So it would, you would be planning on staying in New York after the fellowship. And we do expect that fellows will continue the teaching and or research to some degree during their service. We are looking into ways to assist fellows with placement after their fellowship and finding the right spot for them to complete their service. And we're looking forward to that.
Great. One thing I would also mention is that one of the eligibility requirements for this program is that you have to be eligible for licensure, for dental licensure in New York State. New York is a somewhat unique state in that it does require at least 1 year of residency. And so, we can certainly provide, I think we'll do that in the chat. We'll provide a link to this New York State Education Department, which is responsible for dental licensure. So you can sort of review their requirements. But again, it is imperative that you can be licensed to practice in New York, both during the fellowship year and of course during the service commitment as well. So with that, why don't we then turn to our program directors, and Dr. Rozdalski, if you'd like to talk us through how you've structured the program at Touro this year.
Yes, I am Dr. Rozdalski, as mentioned, and then Dr. DeCenso Brown is the other program director who is not here today, but she's our other program director. And I do not know why my last name is capitalized. I apologize. You can go to the next slide. Okay, so a bit about our program here at Touro. It's multifaceted. We send our fellow to the Westchester Institute for Human Development, or WIHD, and that's 3 days a week. It's located on our same campus here at Touro, just across the parking lot, essentially. And here at Westchester Institute, we also are in collaboration with the Leadership Education, Neurodevelopment and Related Disabilities Program, or a LEND program. And our fellow will spend several months rotating through those lectures that they have through the LEND program, working with other individuals that are a part of the LEND program. And that doesn't mean that they're dentists. There's a vast array of individuals that are a part of this program. So it's nice for networking. And there's a couple of projects in that program as well that you can collaborate with others on. And then we also have rotations at WIHD through primary care, podiatry, neurology, and laboratory testing. And that's open to expand to more rotations, but it gives a more complex overview of an individual that might come to WIHD and all of the different services that they need to rotate through, and just having a better understanding of the patient from a medical standpoint and everything that goes into the dental appointments as well when they come to WIHD. Our fellow also once appropriately trained, will go on the mobile dental van. And I know Dr. Duro our fellow will talk more about his experiences on the mobile van. We also are rotating our fellows through Westchester Medical Center, their ORs, and that can be 1 to 2 days a month. We're also able to do more if an individual or a fellow rather is interested in more OR time. We do have that availability. And then they also rotate through Toro College of Dental Medicine in our clinics 1 to 2 days a week. So just depending on the rotation of schedules, this is how we kind of rotate our fellows. Our fellow is considered junior faculty at Toro, so they are able to also work alongside our dental students and kind of also train them and give them the skill sets that they're learning in their fellowship and pass that along to students. So that is that goes hand in hand also with clinical teaching, and it's working out really well at Toro. It also helps that our current fellow was a graduate of Toro, so the students enjoy having a familiar face there, and learning from one of their own is very helpful. And then also we have research at Toro, and our fellow Alex will be working in conjunction with us with Smiles United, which is one of our grant projects that we have going on at Toro. And our fellow is also working on getting some data from medical charts at WIHD that relate to the patient's medical histories, so that we can try to shorten that line to the operating rooms and try to get some of these patients seen in an ambulatory setting that do have to go and be treated under anesthesia, but to see them ambulatory to kind of decrease the line. As some of you may know, that it's a very long line for most hospital programs. So that is a very brief overview of our program, and Dr. Alex Duro will go into more detail about his experiences.
Great. Thank you, Dr. Wazalski. And actually, before we hear from Alex and Tung, Dr. Kaczynski will take us through how the program has been structured at NYU. So Ron, I'll turn it over to you.
Thank you, Jonathan. I first want to applaud New York State Academic Dental Centers for what they've done. I've been, since we built the center at NYU, NYU is the largest dental school in the nation, and we train over 400 students per class per year. And it's pretty monumental. And the fact that that New York State was benchmarking this fellowship program is just insurmountable, and what this will do to this community of people. So I can't thank the team at New York State Academic Dental Centers enough for their hard work and efforts in securing the funding for these 6 fellowships. It is, if we prove to be a success, this is really a benchmark for the nation, and changing the way that we are able to train young dentists to treat this patient population. This country has not done a very good job of treating this patient population. I was on the phone today with somebody from Arizona who is part of one of the Pacific Dental Centers, which is one of the largest for-profit DSOs in the country. And they have a nonprofit clinic in Phoenix, where they are treating the disabled community at a huge loss of money every year. But they're doing it, and they're doing their due diligence. So I think that it's wonderful that New York State is able to do this. And we're really the first state in the country to be able to provide this kind of training for young professionals to be able to treat this patient population. And if you think about it, if every dental school in the nation was able to take on a fellow, look at what we would do for this community of people, and look at how amazing it would be to be able to change the way that this country treats this patient, this community of people. So again, my hats off to New York State Academic Dental Centers for making this happen. It's pretty unbelievable. So anyway, I was lucky enough to, can we do the next slide, Jonathan?
Yeah.
Thank you. we have a fellow who had done a AGEGE program at Tung, had done it at Columbia, and Tung he wanted a 4-day-a-week program, and we were able to make that happen for him. The center was created and built and opened in earnestly in 2019. It's an 9-chair, $13 million facility with two ORs, two complete ORs as well. So it was the brainchild of our dean, who felt that NYU could do better and that we must do better. So we have pediatrics represented at the college as well. And our pediatric dental team had applied to HRSA for a grant for 2 fellows to work with what we call bridging the gap. And so we have 2 part-time fellows as well, who are appointed through the Department of Pediatric Dentistry, who have been working in the center 2 days per week. We were lucky enough to get Tung Nguyen, who will speak soon. Tung started, it took us a while to get him appointed and get the paperwork done, but he was appointed in December, which actually works out very well because our fellows, the part-time fellows that we have are finishing up. One has moved on and went to pediatric dentistry. She was it was a unique kind of a thing. She was a general dentist for 4 years, trained at NYU, came back to this fellowship, and now is doing pediatrics. The other fellow got a job in Cincinnati at one of the hospitals there, treating the special needs population. So she's beginning that job in August. So I'm very proud of what we were able to achieve there. So Tung started in December, which is great because the new fellows from the HRSA grant will be starting probably sometime in July or August, and so they'll be able to help work with them as well. Tung started in December. Really began in January when we came back from break. The fellowship at NYU, because of the facility, is extremely clinical, and he is treating 2 to 4 patients per day, upwards of 4 days a week. As we hired a full-time dental anesthesiologist to staff the operating room, and with that, Tung is in the OR doing he's done approximately 15 multidisciplinary cases under GA since we're there. Being that we have every subspecialty represented at the college, Tung is able to work with all of the specialists within the university to really provide true multidisciplinary care that has to a patient population that has not ever received it before in a way that we are. I mean, we're doing endo, perio, implants, or oral surgery, crowns in a day. Tung has milled crowns for patients where we're putting crowns in patients' mouths. Then these are things that have never been done in a multidisciplinary approach, the way that we are able to provide the care. So Tung has really been instrumental, and he comes with a year full of experience under his belt, and he's been a true team player in making sure that and working with the other subspecialties within the college to make sure that we are able to provide good care to this patient. Tung is responsible for treating patients with complex comorbidities, those that are beyond the scope of what dental students are capable of. We have the D4s are great, and they rotate through the center, and that course is taught by what we call OMPRM, which is oral maxillofacial pathology and radiology. And those faculty members manage the D4 experience, which is about 5 to 6 days per week per year of their D4 year. So every D4 rotates through, but there are a lot of these patients come with complex medical histories and complex cases that are beyond the scope of what D4s are able to do. So having Tung available to help treat those patients is really insurmountable. Next slide, Jonathan, please. So we have a true multidisciplinary approach, and as I had spoken, where he's really part of a multidisciplinary team where where every subspecialty or every specialty is represented, and his teaching approach is he's putting together, seeing some patients with syndromes that have never been heard of before, and so Tung is going to talk about what he's going to do as far as his teaching goes as we move forward. And I don't want to take up more time. I'd rather have the fellows be able to speak about their experiences. So thank you for the opportunity to let you know what we've done. And again, my hat's off to this team, because what they're doing in New York State is unheard of, and it's unbelievable that they were able to secure this funding. So thank you.
Great. And, before we move on to the hearing from our fellows, one thing I'd just like to add is that, as Dr. Kaczynski was saying, this is really a unique program. It's also unique in that this is the only program that I'm aware of that is actually a state-funded fellowship for treating people with special needs, and that really is a testament, I think, both to the work that that our advisory committee has done with us to create this program and pilot this program, but also I think we really just need to give our give credit to Senator John Mannion. He's a New York State senator, and he has really championed this and is very committed to making sure that people with special needs really do have access, and he's personally committed to this. He actually has a family member who is on the autism spectrum. He's also the chair of the New York State Senate Disabilities Committee, and he is very, very committed to this. And I think it really requires a really multi-pronged approach where we through this partnership, through this consortium, bringing together the 6 dental schools, and also partnering with our champions in state government, has really resulted in this the creation of what I believe to be a totally unique program in the U.S. right now. So with that, love to turn it over to our 2 fellows now, and we'll start in alphabetical order, just because we need some sort of order. So what we'd like to hear from you, Dr. Darrow and Dr. Nguyen, is really just about your experience over this past nearly year, or 6 months to a year that you've been in the program, and hear sort of what has kind of opened your eyes to treating people with special needs. So what aspects were you unaware of going into this program, and really how have you seen this, what you've experienced so far, changing or contributing to the trajectory of your dental careers? So why don't I turn it over to Dr. Darrow first. Alex.
So Jonathan, that prompt was kind of long. Can you make it? It just how I'm feeling.
Yeah, what you've
I've never been.
What's your experience been like? Has it been a good program for you so far?
It's been a great program for me. I've told multiple people, and my wife every day, like, it's just well with me right now. This has been one of the I'm adding it to my list of achievements, is finding out that this is the community that I belong in. This is the community that I want to be working with in my career. So trajectory wise, it has actually completely changed my it has partially changed my trajectory. Initially, I starting with my rotations on the dental van at WIHD that Dr. Rostalski talked about, I saw that a pediatric dentist was treating patients with special needs, and I thought, wow, that's what I want to do. So I thought pediatrics is how I am going to treat patients with special needs. And then after not getting in twice and applying and not getting in twice, it's pretty disheartening. And I thought, okay, well, I guess I have to just be a GP and put special needs on hold. And then Dr. Rozdowski reached out to me and said, you know, we're doing this fellowship. Are you interested? I said, well, heck yeah. That's exactly what I wanted to do. I didn't know, I was ignorant. I didn't know that you could be a general dentist and see patients with special needs. And knowing that that is a niche that exists, that I could fill it. And then it's just knowing that you are where you want to be is an underrated feeling. I know I might seem a little bit naive, you know, he just graduated 5 minutes ago and he's talking about being content, but I am. I go to WIHD, we see more patients. It's a pretty fast-paced clinic there, you know, 10 to 12 patients a day. But then going to Toro, where I'm seeing similar to what Tung is seeing with the 2 to 4. And it's just been, every day is a little bit different, where I'm going to either the van or the clinic or Toro, or, you know, my rotations or Lend, and just every day having a little bit more knowledge and a little bit more experience, a little bit more chance to practice my behavior management, seeing different medical conditions and learning a little bit more about complications. And it's just been very educational, very spiritually uplifting for me, as it might be a different kind of uplifting for others, but for me, just, it's been a great fellowship. And I don't want to take up all the time, but I don't know if you have anything to add there, Tung. What's what your thoughts are here?
What's up, everybody? So first off, I know Dr. Kuczynski was applauding NYSADC, but you know, Dr. Kuczynski does like a super great job as the director of the program at NYU. I wouldn't be there without him, and he teaches me every day. We have great conversations. My experience so far has been very complex in a good way. I'm being exposed to a lot of new things I haven't seen. The center is amazing, extremely like advanced. 2 full ORs, like he said. We had CAD CAM, every single subspecialty I could dream of working with. I really enjoy my time because not only have I been able to treat this patient population, but myself continue to learn. I'm doing a lot of weird things, not weird, but just a lot of abstract things that you probably wouldn't do in like a normal private practice, just because of the subset of population that we're dealing with. Every day it's pretty, you know, it's not insane. I'm not seeing like 80 patients a day, but the patients that I do see they're not easy, just because you have to really figure out how to work your way around certain patients. I have seen special needs patients before, but obviously not just special needs patients. And like overall, it's been great. One thing that I personally have been really grateful for is I never really felt strong about pediatric dentistry, just because I'm gonna be honest, I don't really like kids. I don't feel comfortable around kids. I'm not really great at handling kids, but having Dr. Kuczynski there and, you know, going through all the pediatric procedures and things, he's taught me a lot, taught me to be more comfortable, like, or just, you know, I've just become more comfortable seeing kids now that Dr. Kuczynski's there, and he's taught me a lot. So that's really enhanced my armamentarium of what I can do for my own patients, because like he said, I am doing a 4-day work week at the fellowship and then doing a day of private practice. So everything that I take from NYU, I get to bring into my private practice and help my private practice patients as well. You know, not that they need it or anything, but it makes me a better clinician, it makes me a better provider. So I haven't had one downside of the fellowship. I've enjoyed my time there. I guess the beginning was kind of clunky, just a little weird, just like the whole onboarding thing, but you know, all that paperwork stuff usually takes forever anyway. Overall, it's been great. And if, you know, if anybody has any specific questions, I'd love, you know, be happy to answer them.
Great. Thanks, Tung. You know, one of the things that it's not really a core element of the program, and I'm reflecting on this because Tung and I have talked about this fairly recently, is, you know, we're looking for, clearly, we're looking for people in this program who will go on to, you know, treat people with special needs throughout their careers. We're also looking for really for leaders in this field, and looking for people who will become advocates for this population, and, you know, work with all of us to kind of advance this in New York State and even nationally. But really, you know, we're looking for people who will really take on sort of a mantle of leadership over the years. And really, we view this program, again, that we're going into the second year of this program, we really view this as a growing network of people throughout New York, eventually throughout the country, who really will take this on and help really develop, you know, a much larger cadre of providers who treat people with special needs in all sorts of practice settings. So I think that brings us to the Q&A portion. So I think we should open it up to any questions from our attendees. We'd love to hear from you. I'm sure we haven't answered everything that we possibly could, or that you may have wondered about this program. And so we'd really like to hear from you. And if you have any, as Tung said, if you have specific questions for either Tung or Alex about their experiences, please don't be shy about asking. Okay, we're a little shy about asking. So, yeah, see, we've got one in the chat.
Sure. We have a question. Oh,
go ahead, Jenny. I was actually going to suggest. Why don't you go ahead?
Okay. The question in the chat is, to the fellows, what are the day-to-day challenges while treating special needs patients? Start with Dr. Darrow.
Initially, the biggest challenge for me was kind of adjusting the ideal. You come out of school and you think that, or in residency, and then you say, okay, I got to give everyone a Hollywood smile, and they're gonna come in and we're gonna do everything right. We're gonna do it in a few visits. The biggest challenge has just been, you know, sometimes you can't do everything in a few visits. You have to spread it out more, or you have to reschedule because it's a bad mood day. And you just kind of have to work around a different set of limiting factors than you did previously.
Let's see. I don't know. There aren't too many challenges. Dr. Kaczynski makes it pretty easy. I just show up, put my loops on, grab the handpiece, and we're ready to go every day. There isn't too much. I think the only thing that would be a challenge is that with this subset of population, they usually use government assistance, you know, Accessoride, things like that. They usually have a lot of other medical appointments. So there's just a lot of accommodating, which is not a bad thing, but sometimes, you know, hey, if they have other whatever is going on with them that day, they can't make it. So, you know, sometimes appointments get canceled. Sometimes they don't feel good. They can't leave early. They have to leave early. So you don't always get like the normal traditional, you know, like normal appointment, which is not a bad thing. It just happens. Like some of our patients, they'll have multiple, they'll try to schedule as many appointments they can because they'll come from so far away and all of their doctors are in the city. So just being understanding that, like, you know, some patients can't sit down for 60 minutes, you know, that some patients don't always feel okay to go to the dentist. Just things like that. It's nothing, there's no technical challenges, you know, it's not like my handpiece stops working or the lights stop working or the lights turn off in the building or anything like that. It's more just being understanding about the patient.
Great. We have another question. For the fellows, what percentage of the patients you treat are under general anesthesia versus IV sedation?
I guess I'll answer that one.
Oh, go ahead.
So it kind of depends. It varies. I would say most of them are under general anesthesia. I want to say like 85 to like 95% of the patients I've seen in the OR are usually under general anesthesia. We've done some OCS, some oral conscious sedation cases, and then a few IV sedation cases, but mainly general anesthesia, just because we have the anesthesiologist there, and we have all we just have all like the bells and whistles to do that.
At Toro, it's none. You have to go to Westchester Medical Center on those 1 to 2 days, but during the regular work day, it's either some oral anxiolytics or good luck. And when I say good luck, I don't mean that like bye, good luck. I mean that like we're relying on good luck.
Okay. Does anyone else have a question?
Hi, I have one question. Hello everyone. So my name is Mayank Kakkad. I had opportunity to do my fellowship under Dr. Penova at Complex Care Center at University of Rochester. It's definitely a great program. I learned a lot. Everything that both of the fellows have talked about is I had a similar kind of experience. My question is like, how do we take this career from here on? Like, as we both of them as just said, like most of these patients were seen in the kind of general anesthesia or some kind of a IV sedation or anxiolytic. If someone plans to this fellowship and we try to say, okay, I've done this fellowship, now I want to take this career to the next level. How do we implement this in a prior practice, or how do I take this to a next level? Unfortunately, like, I mean, if we that's one of the reasons, like most of the people or most of the residents, we think that working with special needs comes from the pediatric dentistry, and if that's a route, then it makes much more easier. Obviously, I had an opportunity to do a lot of research with Dr. Pinova. I'm very fortunate. We did a lot of research trying to understand the barriers, why we are not making an attempt to see the patients, because we do have a dental school and we do have a regular residents. So we try to understand and we did some kind of survey to understand what are the barriers. And obviously the biggest barrier that we know that is the reimbursement rate, or if we plan to work in academics. So I'm probably more than my question. I think I'm more curious as someone who wants to work in this field, who wants to grow, who wants to make this his career. We recently attended the ADMD conference, and this was one of the most important that we talked about. We understand that access of care is important. It's one of the bigger thing that we need to work on. But is it really because we don't have enough providers who wants to, or who have a lack of training, or is it because of the other reasons? So I'm just trying to still understand that, okay, I'm a foreign trained dentist. I did my 2 years of PhD. I'm okay to do one more of GPR in order to get a US New York State license, and then plan to do again a new fellowship here. But then where do I go from there after that? Which means not only my passion to work in this field, but also, sorry to say, but financially rewarding in a point where I'm able to, take care of the normal bills. I hope this my question makes sense.
All right, I think I kind of get where you're going with this. Okay, first off, no one's like asking anybody. We all understand like how like insurance kind of runs the dental game, and nobody's saying that you got to see 10 special needs patients a day. I mean, I see special needs in my private practice. Like, I would probably see, I want to say I'd probably see like 10 a month. I mean, at this rate, you're not going to be financially stable if you only saw them, and nobody's going to knock you for that. Nobody, like, Jonathan and I have had conversations about what can we do about those things, and no one's expecting you to be the only person to only see special needs all the time. And this career can take you like a lot of different places. You can make a ton of money doing private practice and, hire an anesthesiologist or whatever your facility, and deck out your facility to see these patients if you want to. it just kind of depends on what you want to do with it. You're still gonna learn. You're still gonna like learn how to treat this like population, and you can see them in your private practice, or you can continue on with academia. Maybe if you're lucky enough, get into one of these roles that one of these like fine directors are in. There's a lot of avenues and ways, as long as you're not limiting yourself. If you only think that, oh, how am I going to be able to be financially stable after this, you're kind of worrying about the wrong thing. Which it's important, but it's just like the wrong thing in this setting.
I saw that Dr. Rostalski had a hand up, and I just wanted to say one thing in response to that. I think part of the equation is really that financial component, and as you know, most people with IDD in particular rely on, at least in part, on Medicaid, and a big part of the equation is addressing the inadequacy of Medicaid reimbursement for treating this population. And so when I was talking a bit about the leadership role, I think that's a component of it. Advocating for this population includes going to our state capital and advocating for more Medicaid reimbursement, more investment in this population, because it is woefully inadequate, and it discourages providers from seeing these patients, because the amount of time they spend versus the reimbursement just doesn't make sense. And we want to close that gap. I think we'll never close it completely, but it really is incumbent on us to take that argument, that fight to Albany, and make sure that we are advocating for this population. Raquel.
Yeah, I was just going to add that, yes, but Jonathan kind of touched on the reimbursement is an issue, but yes, we need more advocates. We need more of us, louder voices. But a larger part of it, even if we do get this reimbursement arranged, a bigger part is that it's surprising how few dentists have the necessary skill sets to treat this population. And a huge barrier is that they just don't feel comfortable. And unfortunately, we see far too often that individuals are so quick to throw their hands up in the air the minute they see that there is some sort of special healthcare need that they're scared of themselves. And then they just refer them. Where are they referring them? That's where the issue is that there's not enough dentists in New York State to refer them to. We've relied heavily on pediatric dentists, and that's just not doing good enough anymore. Pediatric dentists are wonderful, but we also have the skill sets as general dentists to treat these human beings, and we have a moral obligation to treat them as human beings. So we have to train more providers. So that's really what the goals are. But I totally understand the reimbursement piece. I believe you me, I get it. We're going to keep working.
Dr. Krasinski, did you want to address this as well?
I just wanted to reiterate what Dr. Rostalski had talked about. We had this conversation today with someone who is the DSO at Pacific Dental, which is one of the largest DSOs in the nation. And it comes to exactly what Raquel spoke about. And you can change the reimbursement model all you want, but if you don't have trained providers that are comfortable embracing a developmentally disabled patient, a patient with IDD or a cognitive or physical disability, and have not ever seen one before or treated them or been able to embrace them collectively on some level and just be comfortable, then you can pay them anything you want, but it's not going to change. So changing the reimbursement model is important, but doing what we're doing in New York State and training providers to go back out there to be able to do this on a larger scale is what's going to change it. So if you magnify this by giving, as I said before, one fellow to every dental school in the nation, look what we could be doing and changing in the way that we train providers to do this on a global, on a national basis, for certainly for the United States. And then, you think about this globally, what it could do is really, what we're doing is something really amazing. So my hope and my dream is that one day special care dentistry becomes a specialty. And I think that it would be the next recognized specialty by the ADA. It's going to take the effort and the time of these young people that Jonathan is trying to help produce, or that we're trying to help produce, that are going to take this and bring it to the next level. And that I don't know if I'll be around for that, but that would be my hope and dream, that special care dentistry becomes one day a recognized specialty in this country, and that we can really truly provide the quality of care that this patient population deserves.
Well said. I have another question in the chat, and I'm going to direct it to Jonathan. It says, what is the compensation for the fellowship year for both programs at present?
So the compensation is actually, I can't speak for each of the programs, because in some cases it will vary slightly, but the salary for the fellowship year is really tied to average PGY2 salary. So that really is our basis for funding each of the fellowships, and so that is completely covered during the fellowship year.
There was another part to the question. The participant asked if the current fellows would make themselves available for questions afterwards. If you wanted to, if you could drop your email in the chat, that would be very helpful.
And Tung and Alex, thank you both for, I'm assuming that you're, oh, good, there you are. Yeah, thank you for providing that and for agreeing to respond to folks. I know you're both quite busy, but yeah, clearly people want to hear from you and your experiences. So
It's sick. Yeah, Dr. K, back me up. Is NYU not sick?
We have a great program and a great center, and but it's only as good as the people that are in it and take it and operate it on a day-to-day basis. And having enthusiastic young people around is what invigorates me and makes me proud to be the director of the center. And I'm sure Raquel feels the same way about what's going on at Toro.
Great. Any further questions? We're getting close to our hour together, but any final thoughts or questions before we start to wrap up?
I know we focused on Toro and NYU since we have the fellows, but if Dr. Planarova or Dr. Bush wanted to mention anything about Rochester or Buffalo, we are hoping to fund fellows at each of the dental schools. So.
Yeah, I would like to introduce our clinic. We have truly interdisciplinary clinic, which is integrated with medical and other medical specialties. And we see this patient in this clinic together, which is really good. And I think it's amazing learning experience, because in the future, everybody will be more confident to treat patients with medical complexities. Even they don't have to have only intellectual disability, but also people, they are sick when they are older. So even regular patients can have more medical complex conditions. So I feel like my fellows, they are very confident, and they really gain the confidence to treat patients while they can discuss patients with medical providers. So the experience is, I think, very enriching for them. Then we also have OR, and we treat patients with general anesthesia. And we have also oral surgery specialties, perio specialties. And we also try to incorporate with other medical specialties, with eye doctors or OBGYN, so that we can maximize the OR time for the patients, that they don't have to go and be under general anesthesia multiple times when they have some other issues. All the fellows or all the residents which they come through our clinic, they do a lot of clinical care, and they have also time for research and some teaching experience and presentations. For example, now when we have been in AMDMD conference, all my fellows and residents, they presented posters. they really enjoyed working on this. Usually the projects are selected by the residents, which is the preference for them. And we always find faculties which they have a interest in that field. So one of my residents, he presented about orthodontic treatment and IAD population and all other topics. So we will be happy to have another fellow in our clinic because we feel like it's really amazing opportunity that we can actually like learn together and that we can teach like a new generation of dentists to be able to treat this population. Yeah.
I can add a little bit about our program at Buffalo, which I have to admit is still a work in progress in Buffalo. We are currently undergoing a major renovation in our dental school, and part of that renovation is to build a brand new special needs clinic. Our school is not equipped with a special needs clinic as it stands right now, and we are very excited to be able to start implementing special needs dentistry at UB. There is a hospital that we are affiliated with. Dr. Liz Capral is the director of the Special Needs Center there, and they are also in the process of building a brand new center, which will house special needs population. That is scheduled to be done sometime later this summer, but we all know with any kind of construction project, nothing is ever on time. So I can't give anybody an estimate as to when that will fully be complete, but a development that happened just today is that we have a director of one of our pediatric programs who is very interested in possibly having a fellowship through that program. And we are going to start discussions on that. In fact, I have a phone call with her tomorrow to start that, and hopefully we'll have conversations with Jonathan next week. So stay tuned. More and exciting things are happening in Buffalo.
Excellent. Our faculty members from Columbia and Stony Brook couldn't be on this evening, but they're also, of course, just very much looking forward to bringing on fellows this year, and have great programs. Why don't we, again, we're at about our hour together now. We'll go ahead and wrap up now. What I will say though, for anyone who has either applied or is thinking about applying for this fellowship, that the application process is still open. And we're going to be starting interviews in the coming weeks, and so we'll be going into our review phase, and we'll still continue to accept applications during that process until we fill all 6 positions that we're able to fund this year. I see another question has come in.
So the question is there a component of oral health advocacy for the caregivers or parents of IDD in this program?
It's a very good question, and not one that we have really addressed up to this point. I think that's actually a great suggestion, and something that we, with our advisory committee, will discuss. But as of now, we really haven't brought in sort of the community of caregivers as yet. So why don't, again, we'll go ahead and wrap up for this evening. I think you have everyone's contact information, and I'm going to also put an additional contact, which I think everyone should have, for any general questions about the fellowship program. You can send us an email at info@amsny.org. And we really, are here anytime to answer any questions you have as you're thinking about this, as you're going through the application process. We are more than happy to discuss any issues or questions you have. So with that, let's go ahead and wrap up. And I want to thank firstly, all of our advisory committee members for not only for participating this evening, but for participating every other week for the past year and a half on making this program a success. Really, you have done a monumental job, and we, and I think everybody who goes through this program can't thank you enough. And I also want to thank Dr. Darrow and Dr. Nguyen for not only for being here, but for really taking a leap of faith into this program this year. And I think you are both doing outstanding work, and we are very proud to have you in the program. So with that, I hope everyone has a wonderful evening. And again, please feel free to reach out anytime with any questions you may have. Thanks, everyone. Good night.
See you tomorrow, Dr. K.
Thank you.
Thank you.